And today I'm going to talk about prostate cancer. This will be a very basic talk about prostate cancer, as I want the common people to get aware about what prostate cancer is in today's world. We get a lot of information from here and there. So I would, this is coming from directly from me, who's a urologist and an oncosurgeon who will deal with the prostate cancer in much better way than anybody else can provide you information with. So what is prostate cancer? To begin with, what is prostate? Prostate is an organ which is present only in male. The females don't have prostate. So the females will never develop prostate cancer. Now, regarding prostate cancer, why is it important? It is a very important cancer because it can have a very bad effect on your quality of life and at a point of life when you don't want any issues in your life. So it becomes very important. The cancer is a potentially serious disorder and can affect 1 in 7 men. It is the second most common malignancy in men. So this makes it very, very important cancer, and to identify it at a very early stage so that one doesn't suffer long. So what do you do to identify this cancer? The problem is that who can develop cancer? A lot of patients ask, Doctor, can I develop prostate cancer? There are two basic criteria for developing prostate cancer. The one is a genetic factor, which is a very strong factor. If your father or your the first relative had a prostate cancer, then or your brother had a prostate cancer, then there's a very high chance that that male can develop prostate cancer. It is 4 times more likely to develop prostate cancer than from a person who does not have the strong family history of developing prostate cancer or family history of cancer in the family. So this makes it very important, one predisposing factor. The second important predisposing factor is how long you live. So longer you live, the more are the chances that you will develop prostate cancer. So it may be symptomatic, it may be asymptomatic. You may die because of something else. But longer you live, longer a male lives, higher the chance that he can develop prostate cancer. So this makes it very important. The other factors are like ethnicity. Black men are more likely to develop prostate cancer than the white men. So that is one of the causes. And a lifestyle disorder. Yes, prostate cancer is not devoid of lifestyle disorders. And those who are obese, they have high likelihood of developing prostate cancer. Those who there is a lack of exercise or predominantly sedentary lifestyle, they also have a higher chances of developing prostate cancer. So this is what makes it important. And if you are one of those, so you should be aware and be cautious about it. What are the symptoms? It does not have any specific symptoms. And unfortunately, if somebody starts with the bone pains and present to orthopedician, they start evaluating it. So they find that the cause of the bone pains is the prostate cancer, which has spread all over the body. So it is very unfortunate for those people. But otherwise, local symptoms may mimic or they may be same as anybody gets for the benign, that is a non-malignant type of prostatic enlargement, like poor flow, frequency of micturition, nocturia. They may be overlapping symptoms. So a lot of times you may miss this thing. So how do you circumvent this and identify it early? One of the ways is to get your prostate cancer marker done. It is a simple blood test which can be done in any time of the day, and it is available everywhere in India. It is the smaller of the places also it is available, and in the big cities also it is available. It's called as PSA. So PSA is a prostate-specific antigen, and it is this PSA that you will be guided what can happen in the future. So if your PSA is beyond the limits, it becomes mandatory for you to go and consult your urologist immediately. So you may not have any symptoms. You may feel there's nothing. I don't know why this has happened. Let the urologist evaluate you and come to know why this PSA has gone up. Is it because of some sinister disease like a cancer, or is it because of it can be because of infection or something else which has happened to you? So it is very important. Don't get a PSA done just if you have a fever or burning in the micturition. So at that time it doesn't make sense. But if you are not having any of the symptoms and for a general health checkup, you should add PSA to your profile of general body profile, which a lot of people get it done. And the age for this is 50 years. 50 years and beyond. Once in a year, if your PSA is normal, you should get your PSA done. This will help in identifying early prostate cancer. Other than that, all the other symptoms may be overlapping, and incidentally, majority of the cases, you may be able to pick up prostate cancer in yourself or in your near and dear ones. So what is important in a cancer, I always tell my patients, cancer itself is not bad. If you have to, if you develop, you develop. You cannot prevent it. But what is bad is in what stage you present to a doctor. If you're coming quite early at the start of the disease, there is not much, the disease is not spread much. Like we have the stages of prostate cancer, stage 1 to stage 4. If you have come by the stage 2 or even early stage 3A, we can attempt to get you cure of the disease. You can live without a disease and good health, quality of life, you can live. But if it has gone beyond like 3B and it is stage 4, then it is an issue for you. So it becomes very important that the prostate cancer is diagnosed. It is diagnosed early so that we can take care of you. But even if you have missed the bus and in some family near and dear one has not been able to pick up or something has gone wrong, you don't lose hope, because now a lot of things have come up. The new drugs have come up which can help to prolong your life and even the quality of life in you. So you should not lose hope. Fight with the disease and stay healthy as far as possible. Other thing is that prostate cancer itself can sometimes debilitate. The cost factor goes very high in the families, but you can get that consultation in the government hospitals also, so that is not an issue. But the important thing is to get it diagnosed early and pick it up early. That is very important. The types of therapies, the preferable and the best therapy is to get rid of the prostate from the body if it is a local disease. So this can be done with a buttonhole surgery, what we called as laparoscopy or robotic surgery, and a nice job is done, and you can have a normal life as far as as close to a normal life as a normal person can live. But if it is gone beyond it, then the other options are there, like radiotherapy or chemotherapy can be done. So my suggestion would be that if you have a family history of prostatic cancer, you should be aware of it, and you should always disclose that to your urologist so that he can guide you further. Or if you have any symptoms related to prostate and your age is plus 50 plus, you should always take a consultation from an expert, that is a